Like we just showed you there, you want to make sure your hands are clean. That can really affect the reagents in the test strips. One thing that people sometimes do is they will actually lick their hands clean because they don't have anything to clean their hands. And that very much affects the blood sugar and can give quite a big error there. So if you can, you want to do alcohol. If you don't have alcohol, you can just clean your hands and ideally do both like I did there. And then it's more painful if you do it right on the tip of the finger. Oftentimes we'll do it on the side of the finger so that when we have enough blood, and it will tell us 92 on the blood sugar. We're also going to show you how to do my favorite way to test blood sugar, which is a continuous glucose monitor. This is a monitor that will measure your blood sugar 1,000 times a week or more. And it connects with your phone, so we'll show you how to do that. You get an app and you can look at that online how to do that, but it's to the point of scan new sensor. And this is the sensor. You just take it off, and they're all very similar. And it's like you're doing a date stamp. So you just put it on your arm, and it's done. And then we scan the new sensor. And sometimes it's tricky to get it, and you'll hear a beep. And it says scan complete. We'll be ready to use in 60 minutes. And what this continuous glucose monitor does is it measures your blood sugar every 5 minutes and gives you a continuous curve. You can set alarms on there so you can tell if you go high or if you go low. And these continuous glucose monitors are available at any doctor's office with a prescription, and they're as little as $75 a month. Each sensor lasts for 2 weeks, and so you get about 2,000 blood glucoses in those 2 weeks. If you're interested in doing one on your own, there are 2 sensors that are available over the counter that have a similar 15-day wear length, and they connect to your phone also, and they give you a massive amount of information with your blood sugar. And I like to joke it's like having a diabetic educator in your pocket, because it gives you immediate feedback on any activity and any food that you eat. There isn't a proper time to test your blood sugar. My recommendation is to check it many different times during the day. You should check fasting, you should check before a meal, you should check after a meal, you should check before you go to bed. If you're doing a fasting blood sugar, it should be less than 100. Anything above 100 is abnormal, and anything above 126 is diabetes. If it's random times during the day, especially after a meal, anything less than 160 is normal, and anything above 160 to 200 is abnormal, and anything greater than 200 is diabetes.